From patient care to politics, we've examined the health of our health service.
The NHS has a crisis right now.
We've uncovered the £1 billion penalty hospitals have paid for doing more, not less.
This isn't just about money.
We've revealed how NHS workers are making thousands of complaints about staff shortages.
They just can't cope with the pressures.
And we've exposed the worst delays in the system, one bed blocked for a whole year.
It's now starting to creak at the seams.
How then is the NHS planning to tackle the challenges it faces? This is one example. Kelly Founds has mobility problems and depression, but she isn't sitting in her GP surgery or in A&E. She's at home, on the phone to her care navigator, Marita.
Hi Maria, it's Kelly.
Marita is Kelly's single point of contact for all her health needs.
She's a lifeline. She's there. If I have any problem, she's there. And she's just a phone call away. Not just her, but the whole team.
This project in Greenwich, South London, is run by the council and the NHS. But particularly in the community, the health service now faces competition from the private sector. In hospitals, private firms have won contracts that amount to 4% of what's spent overall. But there's been a rapid rise in private companies providing community healthcare. 18% of these services are now delivered by contractors on behalf of the NHS. Carl Walker is from the political party specifically set up to oppose the use of private providers.
To serve the patients of the future, we're going to need all the money we have spent on healthcare, not on shareholders, accountants and lawyers. And to provide innovative approaches to healthcare, we need collaboration and people working together. Markets do not provide that.
However, an opinion poll for 5 News shows 59% of people don't object to private providers. And whoever delivers these new models of healthcare, transforming the way the NHS works, is going to be tough.
It makes absolute sense, but it's not going to save a shed load of money. What it will deliver is better outcomes for patients.
All the experience of trying to develop integrated care models in this country and in others says it takes time, and it may well take longer than we've got.
But in some places, that change is already happening. The new department at Worthing has moved the staff who deal with emergency admissions next to the doctors who are expert in caring for the frail elderly.
The stay here has been unbelievable. They really are fantastic here.
It's one of just 4 projects nationally chosen as a model for the hospital of the future, and the idea came from the staff.
So it started with a conversation between the doctors and nurses and staff that look after patients, and by beginning there, I think that's how you best design future services.
Everyone knows what the health service stands for and what they want it to be. What's harder is knowing how to achieve that. And what's needed now is those who understand it best to pull together to ensure the service we all need has a sustainable future.